it can be scary, and lots of questions. And so when they come to you, and how would you guide them towards the next steps, or what are the next steps you would do? Just if anyone of our viewers are pregnant, and then if they have questions. Yes.
Yeah, so certainly that's a common time, but actually, sometimes the journey even starts before that. Increasingly, women are coming to me, or GPs in general, before pregnancy to prepare for pregnancy. And that's lovely, because then by the time they have that positive pregnancy test, we already know each other.
Yes.
And that can be maybe a little bit less daunting than,
Yes.
I'm pregnant and now I've got to go and see someone and find out all of this information. So that's a lovely beginning, I like to have. But otherwise, so typically you think you're pregnant, or you've got suspicions that you're pregnant, or done a home test. So you've come to see me or one of my colleagues, and the first thing we do obviously is have a chat, get to know each other, and look at what's sort of the current state of the health, and what we need to do from there. So there's things like making sure we're taking the right prenatal vitamin. So having, supplementation for folic acid and iodine is important. Making sure that if there are any health conditions, are they going to impact on the pregnancy, or are there any special considerations we need to look at in relation to that? We're checking in, of course, on medication safety. So if there's any medications that we're currently taking, just having a look to make sure that they are going to be okay to continue in pregnancy. And look, most of them are, I would say, by and large. And then, how are we feeling about a pregnancy? Because sometimes a positive pregnancy test isn't a good thing for some women. So kind of unpacking how we're feeling about that, and if we need to change our management on that. And it gives me an idea already of the kind of life and supports that a woman has, and how she wants to run this journey, because we talk about what we do in pregnancy and all these sort of steps, but of course everything is optional apart from having the baby. And each woman, we want them to feel empowered to design their own way.
Yes.
And to really understand the reasoning behind what we're doing along the way, so that she